Dr. Steve Reardon to the podium, please.
Thank you for having me, guys. Madam Chairman Hart, Representative Hart, and Representative Valentine, I appreciate you guys listening to me today. My name is Steve Reardon. I'm an optometrist in Manning, South Carolina. I moved there about 11 years ago to practice rural optometry where the need is just tremendous. And that's what I've been doing. I live it, I sleep it every day. I wake up in it. I give world-class treatment to patients that otherwise wouldn't even believe it's right there. And I'm very proud of my training from Indiana University School of Optometry. To give you a couple of just thoughts as I practice every day and trying to take care of these patients that have tremendous needs, I want to just hit home some things that I've been thinking about, what the obstacles to access of care. The first one is timing, okay? The eye is such an unbelievably complex organ, and so many pathologies that happen with the eye require immediate attention. For example, 3 weeks ago, on a Sunday morning, I had a call at 7:30 in the morning. A patient described to me symptoms that were almost textbook retinal detachment. An hour later, she was in my office, dilated. In fact, she did have a retinal detachment. She was set up for surgery less than 24 hours later. Okay, that is critical. Okay, that tissue starts dying immediately without oxygen and blood flow. An unbelievable case happened just not a couple, 6 months ago. A patient with a branch retinal artery occlusion, a blockage of a plaque in an artery, blocked the blood flow. He was brushing his teeth and started seeing a wedge missing out of his vision. Unbelievable circumstances. He was going to put it off. He was going to go play around the golf and then maybe come see me in a couple of days. His wife encouraged him to go ahead and come see me. He just happened to drive by my office. Our staff sucked him in. We got him dilated. We saw the plaque. I initiated digital massage. I have hundreds of thousands of dollars worth of equipment in my office. This was saved today right here. This finger pushed and pulsated on the eye and got the plaque to free up. It went downstream. He regained 80% of the vision. It was unbelievable. But that was timing. It was very critical in a case like that, emergency. So timing is critical. And these patients that in these rural counties, they deserve good care just like everybody else. Transportation. Had a gentleman, a construction worker, a nail ricocheted and cut through to his cornea, almost penetrated the cornea. Weeks of seeing him. He is a lot better now. Saw him no less than 10 times. He's a working man, a construction worker. For him to have traveled an hour plus for all these office visits would have been a financial strain on him, both money and time. Okay, transportation is huge. And then we start talking about the poorest of the poor in our counties that can't hardly get to my office, that is just 10 or 15 minutes away. They can't afford the gas, they don't have cars, or maybe they are not legally able to drive. I'm right there for them. Sometimes it's a burden for them to get to me. You might have to pay family members to bring them. Our elderly population, the third key I want to talk about. As our population ages, these problems are not going to get any better. Macular degeneration, diabetes, glaucoma, cataracts are all progressing, and that's all the stuff I'm treating every single day at my office that I make accessible for these patients to see me. I have to keep my schedule not booked out 3 weeks, 4 weeks. I have to be immediate. I have to be able to see them on a whim, on a notice that they come in. I have to get them in.
Dr. Reardon, Representative Nathan Valentine has a question for you.
Yes.
Excuse me, Representative Chris Hart. Sorry.
Yes, good morning, thank you. I was listening to you there. I've gone over the bill in detail, and I've received many phone calls and had several conversations about the bill. As you were speaking, one thing I didn't hear you mention or talk about was qualifications. And let me ask you this. I'm looking at could you explain to me why you believe now that you're not able to do these things that you're asking to do in the bill?
Why we cannot do them currently? Is it just because of legislation?
Okay. Let me ask you this. Is there any distinction or difference in the qualifications between an optometrist and an ophthalmologist that would not qualify you to do the things you're asking to do?
I'm sure you're going to hear another side of that, and as you just heard, but we were trained on the eye. We learned the eye is not just this organ that's separate from the rest of the body. And when we learned in optometry school, we learned about systemic pathology. We learned about systemic pharmacology. We learned about embryology. We spent 4 years learning on the eye, hands-on. That is a lot of time. Dentists, for example, are dentists qualified to do the surgeries they do on teeth? They spend their time focused on this organ. Same with us. Ophthalmology, there are 2 different paths to treat this eye. There are only 2 professions that dilate and routinely treat eye disease and diagnose it. And you're going to hear different opinions. We wouldn't be here